Elsewhere, patients across the country may be subjected to long queues and delayed healthcare services across public hospitals due to the nationwide clinical workers strike that kicked off today. The clinical workers are accusing both national and county governments of contempt of court, citing failure to implement the agreed upon return to work formula and court orders issued in previous industrial disputes. Helen Aura with the details.
The lapse of the 21-day strike notice issued by the Kenya Union of Clinical Officers to the Ministry of Health has proven futile. According to the union, the strike has been triggered by the government's lack of goodwill in resolving long-standing grievances affecting at least 8,000 clinical officers.
We are talking about a return to work agreement that is midwifed by courts and registered by courts. And that is why we are saying it's a matter of implementation. They should have implemented in 2024. They are a year late and they are in breach or contempt of that directive of the court. What was detailed in there? One was that the county governments were supposed to employ more clinical officers as per the staffing norms and standards from the current 8,000 that we have. According to the Ministry of Health documents, for us to be able to implement UHC, we require 24,000 clinical officers.
At the center of the dispute is the delayed confirmation of clinical officers under the Universal Health Coverage Program, delayed promotions and stagnation of careers, non-remittance of statutory deductions by the employer. The clinicians are protesting against the lack of signing and implementation of the collective bargaining agreement. They also want the delayed salaries paid pronto, understaffing in public health facilities addressed, and the immediate implementation of SRC reviewed remuneration structure. They are also advocating for the increment of a health risk allowance for clinical officers, the provision of a comprehensive medical cover for all actively serving clinical officers.
We gave them a free good 1 year, trying to buy their goodwill to come on the table, especially the Council of Governors, to resolve this issue. They have not been available. We have done numerous letters. Until we issue this strike notice, they wrote to us saying that they are willing to go on the table. But unfortunately, they have not been available for the meeting.
On 27th July 2024, the Ministry of Health signed a return to work agreement with Kenya Union of Clinical Officers to give effect the conclusion of the collective bargaining agreement negotiations. Unfortunately, the agreement was not honored. Clinical officers now say they are ready to engage in progressive talks, but until then, they have cast off the scrubs. Helen Aura, NTV.